Suicide is often a topic that is shrouded in mystery and misinformation. It's a complex and serious issue that can affect anyone, regardless of age, gender, or social status. Here are a few facts to bust some myths regarding suicide. First, people who attempt suicide usually do give warning signs. 80% of people who die by suicide gave verbal or nonverbal warning signs. Second, mentioning suicide will not lead someone to attempt suicide. Asking someone about their suicidal feelings may make the person feel relieved that someone is finally recognizing their emotional pain. Third, most suicidal people have not decided they want to die, and there are things that can be done about it. Most suicidal people are ambivalent. This means that part of them is feeling, I want to die, but part of them is feeling, I want to live. Fourth, most people who talk about suicide are not being manipulative or trying to get attention. And even if they are, they still need some kind of help. People who talk about suicide are genuinely distressed and should be taken seriously. Next, we will explore the risk factors, warning signs, and protective factors for suicide. Risk factors for suicide are characteristics that make it more likely for an individual to consider, attempt, or die by suicide. These factors can be individual, relationship, community, or societal in nature. Some of the individual factors that increase the risk of suicide include a previous suicide attempt, a history of suicide in the family, substance use or mental illness such as depression, access to lethal means like a gun, history of trauma or abuse, bullying, and chronic physical illness. Social factors such as social isolation, historical trauma, and stigma associated with seeking help can also increase the risk of suicide. According to the Suicide Prevention Resource Center, the strongest risk factor for suicide is a previous suicide attempt. Warning signs are clues that someone might be thinking about suicide right now. Some of the common warning signs of suicide include talking or writing about death, dying, or suicide, making comments about being hopeless, helpless, or worthless, expressing having no reason for living, increased alcohol and/or drug use, withdrawal from friends, family, and community, reckless behavior, dramatic mood changes, and talking about feeling trapped or being a burden to others. Protective factors are characteristics that make it less likely for individuals to consider, attempt, or die by suicide. Some of the protective factors for suicide include contact with health professionals, strong connections to individuals, family, community, social institutions, and cultural identity, and problem-solving and conflict resolution skills. It's important to know these warning signs and risk factors so that we can help someone who is struggling with thoughts of suicide. You don't need to be an expert to help. With training and resources, anyone can make a difference and save someone's life.